Hello, I'm Dr. Wickham Simonds. I'm an obesity medicine specialist from the Triangle region of North Carolina, and this is Obesity Medicine Perspective. And today, on this short video, I want to talk again about something that I brought up in a previous video. It's been a little while since I've done that video, but it's the idea of, hey, I'm way off track and I'm relapsed. You know, I'm off my diet. I've reestablished a bunch of old bad habits, and I feel bad about that, and I'm gaining weight, and when you get in that mindset, it's very difficult to get out of it because you don't want to face the fact that you essentially you feel like that you failed, and no one likes to think that about themselves, and so you have a way of just trying to mentally ignore it for a while, and you let it go on. And the challenge is to get out of that mindset and to get back in the right mindset, and to get your act together and moving forward again in a positive direction. And so I think when you're kind of in that place, I just want to say, I tell patients this all the time: you're normal. Okay, if you're operating on the premise in your life that you're going to be perfect, well, then you have a false premise, and it is normal to fail. And it's how you respond to those setbacks and failures and relapses that shows the real mark of maturity. And one of your goals ought to be to just get better at not worrying about whether or not you'll fail and relapse, but worry more about, hey, how do I get better at responding to that? Because it's human to get in this position. So obesity being a chronic relapsing disease, when you're thinking about, hey, I failed, remember that there is a real biology, and I've pointed this out. There is a real abnormal biology that makes you really want to gain that weight back. So it's not all just your psychology and a failure of your character. It is a biology that's working against you. Now, there is a behavioral component, and in that regard, I just want to encourage people who are in this state, hey, get over it. Okay, get rid of all this condemnation. You're not going to get a positive result thinking a negative thought about yourself. So don't think about, hey, the weight that I've gained. I'm sure you know why, from a behavioral standpoint, that you've gained some weight back. But I also am confident in all of my patients that you have the ability to turn that around and be successful. And that's where I want you to put your focus, on that successful part of you, the person who's going to get back on track and start losing weight again. And as soon as you're doing that, I know instead of feeling guilty and condemned and like a failure, you're going to feel very positive about yourself. So your challenge is just, hey, let's put together a couple days back to back. Let's reestablish a good routine. I'm going to buy the things I need from the store. I'm going to do some planning ahead. I'm going to prepare that stuff, and I'm going to take it to work with me, or whatever your strategy is there, and then try to just employ that for 48 hours in a row. And you'll find if you can just get a couple days back to back, then it'll become a lot easier from that point, and you're right back on track. And if you're getting regular weights on the scale, you'll see, oh, I'm making progress, and then you get out of that whole negative mindset, and it's all gone, and you're back on track again. So if you need medication to help you do that, and you're out of medication, that's why I'm here. I'm here to make sure that you have access to that, and to make sure that there's no medical reasons why you shouldn't be taking certain types of medications. So if you hadn't been to the office in a while, don't worry, we're not going to make you feel guilty or condemned if you've gained weight. Come on back. We're here to help, and we're here to support you in those restart efforts. And I would just encourage you to get your thoughts positive again, and use us if you need us. So until the next time that we talk, I'll give you the tools, you give me the effort, and together we overcome obesity.